To understand that what COVID is. COVID is actually happening because of a virus, but it has impact on all the bodily systems. But the most affected bodily system over here is your respiratory system. The lungs are the primarily affected organ, and it can actually reduce your breathing capacity. If your breathing capacity is less, you are delivering lesser oxygen to your muscular system, and that's why people face issues like breathlessness, tiredness, muscular fatigue, constant nausea also can be experienced, and the person has a reduced activity tolerance. That means, in a layman terms, it actually causes a lot of weakness and a body ache. Possible complications throughout the process which can happen because of the COVID is that many a times people live in a denial. They are not ready to accept that they may have gotten COVID. See, if you develop any symptoms like flu, wherein you are getting fever, you are having cold or cough, then you have to go and get yourself tested. Now, there are two types of tests which are available, the antigen and antibody tests, which are relying on to the chemical compositions, but the most important gold standard evaluation which is there is doing HRCT of your chest. It shows up how the disease is progressing inside your lungs. The complication which happens is that many a times people wait till they lose their sense of taste or the smell, which are some of the most delayed symptoms. These symptoms usually develop at the end, and because of this, what happens is by the time patient goes for the HRCT, there is already a pneumonia which has been setting in. Pneumonia is a fibrosis of your lungs. Take an example of this way, that lungs are like sponge. If you have a nice pliable sponge, it will hold more moisture. Same way, if you have a nice pliable lung, it will contain a lot of oxygen. Whereas if it becomes hardened, it's not able to expand and contract. It will not be able to deliver its work of absorbing the oxygen from the atmospheric air and transferring it to the blood. So do not wait for too long. So the recovery process of the COVID is usually this way, that when you undergo HRCT, now HRCT for the COVID identification, there is a particular score which has total 25 points. If your score comes from 1 to 9, it's usually considered mild and it can be treated with a home isolation or a quarantine and does not require a lot of medical help. Whereas if your score is anything from 9 to say 19, it's a moderate amount of COVID and you need to follow the instructions given by your physicians up to the T, do some breathing exercises, take the steam inhalation and everything. But if your score is beyond 19, you may require a hospitalization with oxygen support or a ventilation. Yeah. So recovery process of the COVID is such that depending upon whether you have been quarantined or you have been hospitalized, you have to complete your set of medication which has been advised by your physician. But being discharged from the hospital does not mean it's a complete recovery. That's just the beginning of your recovery. You have to work with your lungs with the help of pulmonary rehab to make them more energy efficient. What do we mean by energy efficient? Pulmonary rehab actually takes a two-pronged strategy. First is to make your lung more pliable and compliant to deliver more oxygen. At the same time, we have to work with the different bodily systems and your muscular system also to make the muscles more energy efficient. What do I mean by that? See, for your every work, every muscle contraction, there is a metabolism happening in which the oxygen is acting like a fuel. जैसे हम लोग गाड़ी के बारे में बोलते हैं कि कितना एवरेज देती है. Like when we say a car is delivering a mileage of 12 kilometers per liter, that's the energy efficiency of that car. Same way, we have to make your muscles deliver more work output for the lesser amount of oxygen. The lesser the amount of oxygen required to deliver the work output, lesser is the demand on your lungs to pull out that oxygen out of air. So on one end, you're decreasing the demand placed on your respiratory system. At the same time, you're giving breathing exercises to improve the lung capacity and make the lung more efficient in pulling out the oxygen from atmospheric air and delivering. तो एक जगह आप डिमांड कम कर रहे हो, एक जगह आप सप्लाई बढ़ा रहे हो, and by that method you are improving the recovery by means of pulmonary rehab. So post-COVID, as I told you, that's just the beginning. After the discharge, that's just the beginning of your recovery. You have not fully recovered. And as I told you that we have to make your system more efficient. But जब आप just discharge हुए हो, your system is not that efficient and you have to work on that. But the complications which you face is extreme amount of fatigue. You feel weakness. In some extreme cases who are coming out of the severe bout of COVID, there can be blood clots in the bloodstream. So you have to watch out for those, but that's a possible complication because if there are blood clots in your blood circulation, those blood clots may go and get lodged into your cerebral circulation, may give you a brain stroke, or it may go and get stuck into the blood supply of your heart, may result into something called heart stroke or what is commonly known as a heart attack. So you have to be watchful for those, and if you're developing that kind of tendency and if your doctor has given your anticoagulants, then be very, very particular of taking those medications on time. The another complication is with respect to your respiratory system, that your respiratory system, you may be coming out of severe bout of COVID with a lot of pneumonia. So there is a lot of scarring, as I gave you the analogy before, that if the lung has become more fibrous, more like a hard sponge, it will not be able to expand and it will not be able to pull out oxygen from the atmospheric air. That's a reduced capacity. In that scenario, you have to actually improve your oxygen efficiency. Let's say your lung is 20% fibrosed because of the COVID, then you have to work with your physiotherapist and your pulmonary therapist to improve your 80% to deliver the 100% capacity as your pre-COVID status. Okay. Post physiotherapy or a pulmonary rehab, actually the end results are quite dramatic. We have handled many cases of such post-COVID cases in which the person comes out with a very drastically reduced lung capacity. His person's lung capacity was so low that it was not tolerating the activity at all. For them, it was a task to get up from the bed and go to the washroom, which is within the same room. From there, we have brought a person in around 1.5 months training to the level where that person is able to walk nearly 1 kilometer without any fatigue. So in this fatigue or breathlessness is tackled by the pulmonary rehab by the two-pronged strategy which I mentioned earlier, making your lungs more efficient and making your muscles also more efficient. Post-COVID treatment pulmonary rehab, we have seen increased exercise tolerance. The person is not feeling fatigue anymore. There was a situation with one patient wherein she is teacher by profession, and in today's scenario where the schools are shut, she has to take the classes for the children online, and she had a difficulty even to talk continuously. The way I am talking to you continuously, she would get breathless, and that's why that was coming in a way of her occupation as well. Whereas now she is able to teach online for 3 hours at a stretch as well. So that's how miraculous the pulmonary rehab can, the miraculous results pulmonary rehab can deliver. To the patients who are recovering from COVID is, first of all, understand the COVID. It is very important to understand the level of COVID affection you had. If you had a mild COVID, you will probably not have as drastic symptoms as I mentioned in a few of the previous cases, but still the key is not taking it in a trivial manner. Give it a due importance, do your breathing exercises, take your medicines on time. If your doctor has put you on any supplementation, please take your supplementation. We have also seen an increased amount of muscle breakdown during this period, so you can supplement the muscles with a protein supplementation, as well as take due care of your hydration levels. A well hydrated system works much more efficiently. So make sure you drink at least 2 liters of water every day on an average, and on the hot days you can make it increase the water uptake to 2.5 liters. At the same time, do not miss your exercises because you have to build up your exercise tolerance. And please do not forget, do not be scared of COVID. Don't take it lightly, as well as don't make a monster out of it. It can be easily managed if you do the right things as per the instructions. As soon as you get discharged, if you were hospitalized, as soon as you get discharged, please find yourself a pulmonary physiotherapist who can help you with charting out the road to recovery and be your accountability partner in your road to recovery and keep you on track with your recovery. And last but not the least, see, you have got COVID, you're coming out of it. Many people think of it this way कि भाई मेरे को एक बार कोविड होके गया, अभी नहीं होगा. Doesn't work that way. Many people say I have been vaccinated, I will not get COVID. ऐसा नहीं होता है. You still may land up with a COVID. Vaccines are currently doing a great job, but they are reducing the chances of getting severe COVID. It is still not foolproof that it can give you absolute armor against COVID कि आपको COVID नहीं होगा. So even after you have recovered from COVID, even after you have been vaccinated, first dose हो, second dose हो, दोनों dose हो गया है, still you have to follow the COVID appropriate behavior. What is COVID appropriate behavior? Wear your mask. That's first thing. Second, avoid touching your nose, your mouth, your eyes frequently. Make sure even when you're touching your face, your hands are sanitized properly. So proper sanitation of the hands and washing of the hands. Wearing the mask. Keep appropriate distance. Social distancing is also key. It protects and it reduces the chances of you getting COVID. Thank you.